Yeah, I think that it was significant that he acknowledged that the government had not tested due to, as he put it, inadequate capacity. Now, remember, it doesn't matter that we are catching up with other parts of the world when the infection now has spread so widely. What we really did need was, of course, testing in the early days when the infection was contained and we could have stemmed the further spread. So that's significant. I'm also very concerned that I'm not clear about whether the current approach will have the capacity. There are about 100,000 healthcare and social care workers self-isolating. So the 100,000 tests certainly won't be covering the scale of testing we need if we are to not just identify those who are infected, but contact trace. So I think we need to be realistic that 100,000 just isn't going to help properly sort out this spread currently with so much disease and illness in the community. Remember also that the care home issue, I wasn't clear how we're going to tackle that, because we're not talking about a system where you're not past the peak there. The numbers of infections in care homes are just going up day on day. And we need to put in place some measures now, whether it's around very stringent protective equipment in care homes, and also, of course, those that are discharged from hospital may have a negative result, but still be potentially infectious. So we do need much more clarity on how that will be sorted. But I was also struck by the fact that there are consequences of COVID on patients with non-COVID conditions. You know, we had record waits for cancer care before COVID last winter. And those patients their problems haven't gone away. And many of them, I mean, to say that some cancers are more urgent than others, you know, isn't correct, because cancers become more urgent because you don't attend to them earlier.
Okay.
And also
The app. Are you hopeful that the app might be the panacea?
it won't be a panacea in itself. It has to be matched by a capacity of testing, which will have to be much more than 100,000. And you know, the question about the virus. Remember, the vaccine. We haven't got a vaccine, but Korea, Wuhan, Taiwan are resuming normal activities. So it is possible to contain the infection if you have the capacity to test and isolate those people who are infected or potentially infectious.